So after this week's reading, the first basic concept that I see in Nightingale's work is that of human connection. I think that this is something that we as nurses all strive to have. We want to connect with our patients on a deeper level, on a personal level, because it helps us become more in tune to their needs, how to best treat them, how to best serve them. Although Florence Nightingale's was in relation to the service that she was, it was service to God. She worshiped this God, and she felt that it was her calling to help treat patients through that worship. She felt that human spirituality is intrinsic, and whether you take that as in the way that you worship a God or just how you live your basic life, I think that human connection really drives both her and modern day nurses because that is something that's so vital to our job. She also felt that there shouldn't be any judgment between us and our patients. We shouldn't be judging them for what they do or don't have or how they live their lives. But our work is to connect with those patients and treat them and serve them in any way that is best for them. I also saw a large amount about advocacy. She was a super powerful advocate. She worked with politicians. She argued for sanitation changes, and she wanted patients to be treated with respect. She didn't want to just quarantine and leave patients to die. She wanted to advocate for changes in society that allowed patients to live their best life. She also advocated for education through the Florence Nightingale School at St. Thomas Hospital. She always wanted nurses to be educated. She felt that that was the best way towards successful and safe nursing. Some significant contributions she made to current nursing, first and foremost, I think, is hygiene and communicable disease improvement. Something that today that we're still always improving on, whether it's making sure we use aseptic technique or we're using the proper gowns and masks if we need to, and making sure that infection control is always on our mind, because this is like one of the biggest issues that we run into in the inpatient setting. Due to the illness levels of the 1900s, she was super big on anti-contagionism, and clean environment would help keep disease rates lower, although it was flawed in the fact that she believed in dirty air and didn't necessarily believe in bacterial infections right away. I think that there's some really significant improvements towards this kind of career path that she made back then that's still prevalent today. Another significant contribution that I see is her holistic view of patients. So, her idea was to see the patient as an entire unit, treats the patient as an entire unit. So health promotion, avid supporter of health promotion. Health isn't just the absence of disease, but a culmination of a bunch of different factors. And that's environmental, that's physical, that's psychological. In her words, her ideas of the environmental aspect was air, light, warmth, cleanliness, quiet, and diet. And that's something that we still see today, making sure our patients are comfortable. Do we turn the lights off? Do we make sure it's quiet? Make sure they're warm, or they need to be in a colder setting. We're making sure that they're eating the right things for their bodies, making sure they're getting exercise. So kind of that holistic view of health and patients, treating them as a whole and rather than just treating whatever's ailing them at the moment. Another thing that I think is important that you see today is her work with leadership and advocacy. She felt that nurses should be seen and heard. I mean, we are the bridge between patient and provider, and even though hers was kind of rooted in feminism at the time, that was a woman's job, and women should be heard because they're the ones taking care of these sick and ailing people. Obviously, today that's not really a thing anymore. There's plenty of men in this profession who excel just as much as women do. Her idea that nurses should be at the forefront of medical and health reform is really important, because we are the ones who work with patients all day long. We are with our patients all day long. We know and we hear what they need. being an advocate for them, making sure we look at safety reform. For her, it was environment, cleanliness, health promotion. I mean, for us, it's the same thing, plus evidence-based practice and safe patient to nurse ratios, things like that, like advocating and being a leader in the field of those kind of changes. You know, looking at data collection that she did to help prevent disease. That's something we still do today. When I think about non-empirical patterns of knowing, I think the one that I think about the most and I see on a regular basis at clinical and in the hospital is that ethical pattern of knowing. And I think it's because it's so variable between person to person. It's not as cookie cutter as empirical, or, I mean, even like your own personal experience. It can change just based on how you were raised, what kind of religion you have, what your culture is. Realizing that your ethical pattern of knowing can be vastly different than somebody else's is really important to nursing. I mean, I think we use the Jehovah's Witness blood transfusion example a lot, but that's a great example. I might think if there's a child who's dying and can only be saved by a blood transfusion, should get that blood transfusion, but due to his culture and his religion, I need to respect the wishes of that family, because acting on my pattern of knowing in that sense would cause more harm than it would good. And I think that Nightingale's work and pattern of knowing informs nursing today in its entirety. You have to take all of it in, the empirical, the personal, the aesthetic, the ethical, the socio-political, and integrate that into nursing every day. Because all 5 of those pieces and everything that Florence Nightingale set up is something that we see on an everyday. Empirical meaning, you know, that's like the day-to-day what we do. We hang meds, we give meds, we make sure things are clean, the things you can see. Whereas personal, as you're able to like meet with patients personally and reflect on how you've done and what to do better and what you did good, the aesthetic, that meaningful connection with your patients, that art form. Ethical, as I just discussed, it's different in every setting. And then also the sociopolitical, because there are institutional practices and institutional policies that we have to abide by. So I think that trying to find a way to integrate that into your everyday life as a nurse is extremely important.